Welcome to the world of podiatric sports medicine. We are trying to figure out how do podiatrists fit into the medical team. You know, one of the things that happens with patients is they exercise and they want to continue exercising, but if they sustain an injury, the biggest fear of going to the doctor is figuring out, like, are they just going to stop me and tell me, okay, now I can't do that activity anymore? So part of being a podiatric sports medicine physician is figuring out how to not tell them what they can't do, but tell them what they can do. You know, so giving them a game plan and a treatment plan that allows them to be able to either cross-train or do some level of activity really boosts spirits and helps overall health. With that in mind, we have really integrated with a number of different medical professions, whether it be orthopedics, physical therapists, chiropractors, physical medicine and rehab, primary care docs who work in sports medicine. And what that does is that helps us become part of the training team that actually helps these athletes stay as active as can be. Now that doesn't mean they can't sometimes not be able to do something, but you know, giving them an alternative activity can be very helpful. That said, you know, we have a little bit of good stuff in that I work with some of the local colleges, high schools, and the professional sports teams. I work with both the NBA, the WNBA. We worked with Georgetown University men's basketball team, the Washington Capitals, and hockey, some of the local soccer teams. And what ends up happening is that gives you a little bit of clout to these patients who know, okay, at least we got somebody who might know what they're talking about. So all that said, we really want to try to figure out how to keep people active, because that's just so good for their overall health, especially here in Washington, D.C., where a lot of people are type A personality, they have high pressure jobs. Exercise is a very important part. They're used to succeeding and they want to figure out how to do that. So in that light, I think that that's actually very helpful. It has been good for our practice. I've been able to bring in some younger practitioners who have been able to pick up, you know, some tips and things like that. You really want to learn a lot, as much as you can, about sports medicine and the podiatric field, which is being involved with the AAPSN, the American Academy of Podiatric Sports Medicine. Become a fellow, go to our meetings. You know, the American Orthopedic Sports Medicine Association, AOSSM, is a really good meeting to go to and learn as much as you can about a different type of medicine than just diabetes and palliative care.